Chennai's Pallavaram after 3 residents died and 20 others fell ill yesterday due to alleged contaminated drinking water. The sick were rushed to Krompet Government Hospital, where some were treated and discharged while others are undergoing treatment. Residents of Pallavaram claimed that drinking water in their area became contaminated after sewage mixed with it during the recent rains in the city.
Recently in Chennai, people died after drinking contaminated water. To stop such incident, we have created a solution to prevent waterborne diseases. In many parts of Northeast India, people still use ponds, rivers and hand pumps for water, which often causes illness like diarrhea, cholera and typhoid. With poor access to clean water and healthcare, these diseases spread fast. Our goal is to detect risks early and keep communities safe. We are Team Impact Makers 1111, working to ensure safe water and healthy lives for all. The problem statement itself, they specified that we want to create a mobile purse design. So we created a Jalam Jeevan application, which is a mobile purse design. So in this Jalam Jeevan application, we are going to collect the data from volunteers and local clinics or ASHA workers. The clinical data can be get from the patient reports, and the volunteers data can be get from the IoT sensor. So first we need to log into this particular application. We enter into this application as a clinical member. Okay. Once we enter into this application as a clinical member, we want to put the patient report. So I want to go into press the submit new report. Once I submit the report, the data can be extracted from the patient report using PyTesseract and ACOCR ML model. So the patient name and those details cannot be added into this extracted data, because we are providing data privacy by having the anonymization or pseudonymization on patient reports. So once we get this data, we need to confirm and report the data, and once we return to the home, then we can see the profile and we can see the analytics. Okay, let me log out and enter as a volunteer. Let me log into as a volunteer. So in this volunteer panel, we need to connect our IoT device with our mobile application using Bluetooth connection. Once we turn on the Bluetooth and we want to connect the mobile application with the sensor, so here I click my sensor and give connect button, and once we connected, the data is going to be fetched from the sensor, and this is the extracted sensor reading, pH level, turbidity, temperature and sampling time. Once we get these data, we need to submit the reading and the data is submitted. So let me see how the registration process happening. Here there is a sign up button. You need to click the sign up button. Currently we are looking the admin page for Jalam Jeevan application. In this particular admin page, we can see the dashboard overview, graphical representation for the statistical analysis of waterborne disease, and also by this website we can generate alerts and notification for particular department, like such as health officers, municipalities. We can provide alerts or notification to them. So in this dashboard we can see the statistical analysis of cases, village monitored, water quality, and we can risk assessment. We can generate the risk assessment score, and also we can see the graphical representation of the statistical analysis. By this way we can see the disease trends, water quality overview. These are all the alerts and notifications, and this is the disease surveillance. The same graphical representation of disease trends we can see on here, and also much more graphical representation we can able to generate. And then here we have the recent case reports. Where do we get these data? We get this data from clinical local clinics, ASHA workers, and also we are providing data privacy for clinic data. In this particular area you can see there is no patient name. They just give like anonymous patient. We are giving data privacy for clinic data by providing anonymity and pseudonymization. Then we can see water quality data. These data are get from volunteers using the IoT sensor. And by this thing, we can generate these kind of graphical representation and statistical analysis. Then also we can provide alerts notification. These alerts are generated by ML model. We don't need to give it manually. And this is the community report. The community can report their own cases in description, what happened, how the particular disease occurred to them. We can give report in this particular thing using volunteer page. Then here is the overall analytics page, like health performance, water quality, disease distribution, those kinds of things. Also, we can export the report. Yeah, and this is the user management. In this area, we can manage the volunteer data and local clinics and ASHA workers data. So this is all about the admin page. Thank you. Sensor data. This is the ML model we trained using random forest. In future, we are going to train the ML model using XGBoost and to have LSTM for time series data. And once we train this model, we can give the particular PHDO, BOD input IoT data. Once we give that data, we can get the output, what kind of disease can be spread by those water. We can get those data. And this is the accuracy for a random forest accuracy, training and testing. And this is a feature extraction importance. This is our ML model. Thank you.